My name is Dr. Pace. It's nice to meet you. How are you doing today? Good, good. So I see here that you're in for a checkup, a physical exam. Is this for work or is it just a personal checkup? Okay, okay, great. Well, as I said, my name is Dr. Pace, and I will be performing your exam today. It should take around 20 minutes. It's a head-to-toe examination. It's just making sure that everything is working okay. It's pain-free, so nothing to worry about. In fact, I've heard from some patients that the examination is actually pretty relaxing. If there at any point you do have discomfort, please just let me know. Okay? Alright, well, let's get started with some case history. Okay, so just to confirm, what is your name and date of birth? Okay, and can you tell me what day of the week it is? Okay, good. And who is the President of the United States? Excellent. Do you know about the last time you came in for a doctor's visit? About a year ago? Okay. And do you have regular checkups? Good, wonderful. How about the dentist? Do you have a regular checkup at the dentist? Get a cleaning done? Okay. Do you get regular eye exams? You do? Okay. Do you wear glasses or contacts? Okay. Do you suffer from any allergies? Adverse drug reactions, food intolerances? Okay. And are you on any prescription medications? Any over-the-counter medications? Okay. Do you take a multivitamin daily? Do you smoke? Okay. Are you regularly exposed to secondhand smoke? Okay. How about alcohol? Do you drink alcohol regularly? About how often? Okay. Okay, so how is your general mood? Do you have any chronic anxiety or sadness? Do you have any trouble sleeping? Have you ever had a surgical procedure? About how long ago? Okay, you're doing great. Just a few more questions. Okay. Have you ever been hospitalized? Okay, can you remember when? That's fine. Any other past injuries or illnesses I should be aware of? Maybe in your childhood or in the last few years? No? Okay. Okay, so next I'm going to ask you if any immediate members of your family have ever been diagnosed or have suffered from illnesses. Just answer to the best of your knowledge, okay? Great. So have you or any member of your family experienced high blood pressure? Okay. How about heart disease? Any history in your family? Stroke? Alzheimer's? Any asthma or breathing problems? Lung problems? Any other major or chronic illnesses in your family that you think I should be aware of? Okay. All right. so that concludes the history. So now we can start with the physical examination. So I see here that the nurse took your blood pressure, your height, and your weight, but she didn't take your pulse, so I'm going to go ahead and do that now. Okay. So if you could just put out your arm for me, please. Yep. Thank you, and just relax. Okay. Just relax. Okay, great. Okay, so next I'm just going to check your heart rate. So I'm just going to take a listen here, and please just breathe normally, okay? Good. Alright, I'm just going to check your lungs, so just take a deep breath in and out. Alright, another breath in and out. Again, please. And out. Okay, I'm just going to come around the back. Just a nice breath in. Let it out. Again, please. One more time. Great. Well, everything sounds normal. Alright, so I'm just going to start first. Just kind of feel around your scalp and your head, okay? Alright, so just relax. Good. Good. Have you ever had any issues with chronic headaches or migraines? Okay. Alright, I'm just going to feel around on your face. Okay. Do you ever have any sinus headaches? Pressure in between your face? Okay. I'm just going to feel your lymph nodes. I want to put some pressure here. Any discomfort? No? Okay. Good. Okay. And when I touch here on your face, does it feel the same here? Okay, how about here? Same on this side? Great. And one more down here. Does it feel the same here? Wonderful. Okay, so now I'm just going to check your eyes. So if you would just follow my pen. Okay, so keep your head straight and just follow with my eyes, okay? Great. Okay, great. Okay, and so now I'm going to check your peripherals. So my pen is going to start over here, and you're just going to let me know when you see it, okay? All right, here we go. Okay, good. We're going to go on this side. Wonderful. And we're going to go from the top. Perfect. And one more time from the bottom. Great. You're doing great, hon. Okay. Alright, so I'm just going to ask you to do a few things with your face. So can you wrinkle your forehead? Great. And raise your eyebrows. Okay. Can you shut your eyes real tight? Okay, and don't let me open them. Wonderful. Okay, so I'm going to grab my little pen light here, and I'm going to take a little closer look at your eyes. All right, it's not a very strong light, but if it bothers you, just let me know. But if you can, try to keep them open and not to blink, okay? All right. Okay. All right, and if you could look up for me. Okay, and one more time. Okay, perfect. Your eyes look perfectly healthy. All right, so I'm going to take a look in your ears now. So I'm going to start on this side. Okay, just going to pull down gently. Okay, that side looks good. I'm going to come over here. Do you ever have any problems with excessive earwax? No? Any ringing in the ears? Any pain? Okay, good. Do you ever suffer from any hearing loss or a buzzing sound? No? Okay. Alright, so I'm just going to test your hearing. I'm going to whisper a word in your ear, and I want you to let me know what it is. Okay, so I'm going to start on this side. Patience. Okay, and now on this side. Relax. Great. Okay, your hearing is perfect. Okay, so if you could just look up slightly, I'm just going to check out your nose here. Okay. Okay. Alright, that looks good. Any stuffiness or runny nose? Okay. Alright, so I'm just going to ask you to do a few more little things with your face. Could you puff your cheeks out? Okay. Stick out your tongue. Say ah. One more time. Okay, great. Do you ever suffer from a chronic sore throat, excessive dryness? Okay. But how many glasses of water would you say you drink a day? Yeah, I know it's hard sometimes. Okay. Can you smile for me? Okay. Frown. Wonderful. You're doing great. Okay, so I'm just going to go ahead and check your neck. So just relax. Any difficulty swallowing? Alright, can you swallow for me? Great, great. Okay, your thyroid feels good. Alright, so I'm going to move down to your shoulders and your arms. So can you shrug your shoulders for me? Okay, good. So just put your hand out for me. I'm just going to take a look at your arm. That's right, here we go. Yep, just relax. I'm going to flip it over. Okay. Great. Any problems? Any carpal tunnel or tightness in your wrist? No? Okay, good. Alright, I'm going to check on this side now. Just put your hand up. Thank you. Flip over. Any pain on this side when I touch there? Okay. Okay, good. Good. Alright, so can you put your arms out for me and rotate them? Good. Can you flex up the wrist? Good. And then this side? Wonderful. Okay. Alright, so now I'm going to move down to your chest and abdomen. I've already checked your lungs and they sound great. So I'm just going to take a little feel, just make sure everything feels alright. And again, if you feel any discomfort, please just let me know, okay? Alright. breathe normally. Does it hurt when I pulsate there? Okay, good. Alright, everything feels good. Any pain in your stomach? Okay, everything feels good. You're doing great. We're halfway there. Okay, so I'm just going to move down. Now I'm going to move down to your hips and your knees. Okay, so just stand up straight for me. Alright, I'm just going to ask you to close your eyes. Okay, just stand still. Okay, that's good. Your balance seems okay. Alright, and I'm just going to ask you to go that way and just take a walk and then come on back, okay? Good, and turn around. Come this way. Okay, good. Your gait seems fine. Okay. Any problems at all with your knees or your feet? Any swelling, pain? No? Okay. Okay. Alright, so go ahead and have a seat. That's right. Okay, so just extend your leg for me. Okay, perfect. And now you can bend it back. And can you do the other one? Out. And in. Perfect. Any discomfort with that? Okay. All right. And how are your feet? Any pain, tenderness? No? Okay, good. Okay. All right, you can stand up. All right, well, that concludes the exam. Everything looks great. You look to be in perfect health. I will write up these results and add them to your chart. If anything changes or something is bothering you, please just let me know, and we can schedule another appointment. Do you have any questions for me? No? Okay, well, it was great to meet you. Thank you, and I hope you have a wonderful day.